So the CDC now recommending updated COVID vaccines for everyone 6 months and older.
All right, so the reformulated shots are designed to protect against the latest Omicron variants, which doctors say are behind the current increases in COVID cases and hospitalizations. So the doses should be available this week, should we get it. This morning, the professor of pediatrics at the Children's Hospital of Philadelphia, Dr. Paul Offit, back on Good Day New York. Nice to have you back. All right, so Dr. Offit, I think I can hear you. Let's start with, should adults be getting this COVID-19 new vaccine?
Focus on highest risk groups. The goal of the vaccine is to prevent severe disease. And so who's most likely to get severe disease? Who's most likely to be hospitalized or go to the intensive care unit? It really falls into several high-risk groups. One, people over 75. Two, people who have multiple comorbidities like chronic heart disease, lung disease, diabetes, obesity. Three, people who are immune compromised. And four, women who are pregnant. So those groups really are the ones who should be getting this booster dose.
And what about children?
I think children should be vaccinated. I mean, if you look at what the CDC presented yesterday, what you found was that the group most likely to be hospitalized, not surprisingly, were those over 75. The second group most likely to be hospitalized were those between 6 months and 4 years of age, many of whom did not have underlying health problems. The reason that group was most likely to be hospitalized is only 10% of people in that group, children in that group, are vaccinated. So it's not that they really should get a booster dose. What they need to do is to be vaccinated. And I think it's just a highly under-vaccinated group. I think people think that children are not at risk of this disease, but they are. There's been almost 2,000 children who have died from this virus.
So between 4 and 75, we can skip this vaccine?
I think if you're not in a high-risk group, you shouldn't feel as compelled to get it. But again, if you're around people who are immune compromised, if you work in a nursing home, if you're about to visit people who are elderly, it's probably reasonable to get it. But I think for the most part, a healthy young person isn't going to benefit nearly as much as someone who's in a high-risk group.
So, Dr. Offit, why is there a difference in opinion on this from the CDC saying all Americans? You're saying just high risk over 75. I mean, you would think that we could come together and get the message very clear and be on the same, same path of ideas on where this vaccine should go.
I'm with you. First of all, we're a sort of an outlier country. I mean, if you look at the United Kingdom, Germany, the Scandinavian countries, the World Health Organization, all recommend targeting high-risk groups. We're sort of unique in this, and I think it's because we know that everybody is at some risk, and therefore everybody at some level would benefit. But I do think if we're going to really get our message out there, we should really try and keep people out of the hospital and out of the intensive care unit. And the best way to do that is to target really those who are at highest risk.
Let's talk about some of the migrant students entering the school system right now. We have over, thousands and thousands of them. We know that the migrant students are supposed to be getting these same vaccinations as students that have been there for years. However, they do have a 30-day grace period to do that. So is that worrisome for you? I know some parents were worried about that as well.
I think you should worry living in the United States. I mean, we eliminated measles from this country by the year 2000. It's come back because a critical percentage of parents have chosen not to vaccinate their children. I mean, in 2019, for example, we had 1,200 cases of measles in this country. There were 20 cases of measles in Mexico. I think that there was an outbreak of measles in Columbus, Ohio within the past year. We've had more cases of measles in the first 5 months of this year than we did by about a factor of 5 than the first 5 months of last year. I think we should worry being in this country because a critical percentage of parents are choosing not to vaccinate their children. And now up to 1/3 of American parents think that there shouldn't be any school vaccine mandates. I'm really worried about the erosion of vaccines in this country for children because the virus that's going to come back is measles. And measles can make you sick and it can make you dead. We had 500 deaths from measles before there was a vaccine in the early 1960s. I think if you really want to worry about being in a country now that has an erosion in vaccine rates.
Wow. You think people are just vaccine tired? We had that big push. People were trying to get the vaccine before their time. They would jump in the line. They were then being ridiculed. And then when it was time for you to get the vaccine, some people didn't want to get it anymore. I mean, do you think we're just over it?
I think what happened was by sort of having mask mandates, vaccine mandates, we sort of leaned into a libertarian left hook, and people pushed back. And that pushback has extended from beyond COVID to other vaccines. I think that's what you're seeing. There never used to be a politics to, if you will, the anti-vaccine movement, but there is now.
What about mask mandates for kids going back to school? And one of the Maryland schools implemented that after 3 or more individuals tested positive for COVID.
I think it's very hard to do that. I think probably the most sensible thing to do is if your child is sick, they should stay home. If you or your child is sick but can't stay home, but then at least wear a mask, because all these viruses are potentially harmful. I mean, respiratory syncytial virus, kills 10,000 older Americans every year. Parainfluenza virus kills thousands of people every year. Flu causes hundreds of thousands of hospitalizations and at least 20 to 30,000 deaths every year. And somehow those viruses are grandfathered in. I think they should all be treated seriously. And so if you can, if you're sick, stay home. If you can't stay home, at least wear a mask until you don't have symptoms anymore.
All right, before we go, flu shot or no flu shot?
Yes. Get a flu shot every year. I'm definitely getting a flu shot this year because flu changes so much from one year to the next that natural infection immunization doesn't protect you the following year. It's really important to get a flu shot. SARS-CoV-2, the virus that causes COVID, is not quite that, because people who've been naturally infected or vaccinated are still largely protected against serious disease, even with these new strains.
Good to know, Dr. Paul Offit. Immunity counts. Thank you so much. Have a good day. And stay healthy.